Hi, Mr. Burns. How are you doing today? Good. My name is Emily. I'm a student nurse with the University of Memphis, and I'm going to be taking care of you today, okay? Can I verify your name and date of birth, please? Awesome. Thanks so much. All right, so it looks like we're going to be doing a sterile wound dressing, or not sterile wound dressing. We're just going to be changing your wound dressing today. And so I'll just take your old dressing off and assess the wound and make sure everything's looking good. And then I'm going to put a new one on. And this is just to prevent infection and just to make sure that you haven't already developed an infection, okay? Awesome. Okay, so now I'm going to maintain your privacy. I'm going to close this curtain right here. And then I'm going to raise the bed up and take the side rails down so I can get a better view. And now I'm just going to expose you, okay? I'm just going to pull your blanket down to about your waist and pull your shirt up just so I can see the dressing, okay? Awesome. All right. All right, and now I'm just going to do hand hygiene and put some gloves on. I'm just going to loosen the edges of the tape and then pull it up towards the center, okay? It shouldn't hurt. Pull it up. All right. I'm going to pull the gauze up. Alright, and there's no drainage on the gauze. Looks awesome. Alright, and I'm going to take off these gloves. I'm going to get a new pair. In reality, I'm just going to use the same gloves, but we're going to pretend here. And I'm going to do hand hygiene and get a new pair of gloves. And now I'm going to open my dressing kit and drop this. I'm not going to use this. And so I'm just going to take this drape and just let it fall open. And now I'm going to lay it down. A second. I'm going to move this so I get a good. I'm going to move this right here for a second so I can get it good. Alright. And now I'm going to tilt the contents out. And now I'm going to just take these swabs and I'm going to open them up and clean the wound. I'm going to start from the middle. Alright, trash that. And then I'm going to go to the outside on the other side of me. Go down. And then I'm going to go on the inside. I'm going to trash this now. I'm going to go on the inside and clean. All right. So your wound's location is, your wound is midline. The length is about 6 inches with 7 sutures, and the surrounding skin looks healthy and non-irritated. So now I'm going to take these gloves off and perform hand hygiene again. Put new gloves on. Alright, and now I'm just going to pinch this gauze in the center. Oh my goodness, it's all stuck together. Okay, there we go. I'm going to pinch this gauze and just drop it. Pinch this gauze and then drop it. Just poke it down a little bit. And then I'm going to take this pad, pinch it open, and then I'm going to just drop it on top. There we go. Just make sure it looks good. Alright, now I'm going to tape it. Let's see about that one. Take this. Sticking to my gloves. Alright, tape this down. Alright. Oh goodness, where did the tape end? There it is. Trying to get the end of the tape up. There we go. Okay, about right here. Keep the end open for this one. And then tape this down. Goodness. Tape it down. And last piece of tape. And tape it down. All right. Looks awesome. All right. So now I'm just going to take these gloves off and perform hand hygiene. All right, now I'm just gonna put your shirt back down, keep you comfortable, and put your blankets back up. I'll get you your call light. And do hand hygiene again before I leave the room. And let me lower the bed too before I forget. Alright, I'm going to lower the bed and put the rails back up. And I'm going to do hand hygiene before I leave the room. Alright. Okay. Okay, so today we replaced a wound dressing on Mr. Burns. The wound was about 6 inches long. The edges were approximated. He had 7 sutures, and did I say it was 6 inches long? I forget if I said it was 6 inches long already. And so there was no drainage, which was good. The skin around it was not irritated, and it looked pretty healthy. And Mr. Burns seemed to respond very well.